Hello, I'm Dr. Sridhar. I'm a senior consultant in the Department of Obstetrics and Gynaecology at Fortis Hospitals, Bangalore Road. Today I'm going to talk about the topic of normal delivery. I think as doctors nowadays we need to emphasize on patients delivering normally rather than having a cesarean section done. I've been in this area of practice for the last 22 to 23 years, and I see an increasing trend of patients asking for a cesarean section, which is called as section at request. Now, the reason why these patients ask all these things are because of various factors. One is the pain, the fear of pain of a normal delivery, and the fear about the process of the normal delivery per se. Now, before I talk about all this, I would like to very briefly touch upon what are the different stages of labor, what are the different stages in normal delivery. Now, in normal delivery, we have different stages, that is the first stage, the second stage, the third stage, and the fourth stage of labor. The first stage of labor is the time between the patient getting into labor and the cervix dilating fully, or what we call it as full cervical dilatation. The second stage of labor is when the cervix is fully dilated and the baby is being born. The third stage is after the baby is being born, the placenta getting expelled out. That is the third stage of labor. And we also have a fourth stage of labor, which is a very important stage of labor, where the mother is observed for 2 hours after the placenta is expelled, and this observation happens in the labor room itself. This is a very important stage because we can have patients having excessive bleeding, what we call it as postpartum hemorrhage, during this stage, and we need to observe the patient, we need to treat it timely, otherwise things can get complicated. Now, let me come to the topic of why patients are opting out for cesarean sections. One of the main reasons is that there is a fear about the pain in labor. I am very happy and proud to say that in Fortis Hospital, Bangalore Road, we definitely try to allay this fear in the patient through various methodologies. First, initially she is counseled, the patient is counseled regarding what is labor all about. And regarding pain relief, we have different methods of pain relief, and one of the best method, which is called as Epidural Analgesia or labor analgesia, is practiced very frequently in our hospital. I can very confidently say that about 50 to 60% of my patients take epidural for pain relief, and because of this they are comfortable and they have a pleasant experience about the normal delivery. Another reason why patients opt for cesarean section is, one, they want to deliver at a particular time, a particular date, which should be definitely discouraged. And the third thing is that they have fear regarding the mother's life, the baby's life during the entire process of labor and normal delivery. I, as a doctor, I would definitely counsel the patient regarding this entire process, try to allay their fears and try to make them understand. We also tell our patients that we have a very robust team in the labor room, which involves doctors who are dedicated to handle labor cases. We have an entire midwifery team which is dedicated once again to labor patients. We also have a 24-hour anesthetist and a 24-hour pediatricians who are there round the clock to help any problem in the mother or any problem in the baby. With all this information, most of my patients get convinced to try for a normal labor and go through the entire process smoothly without any problems.